Centration is a central line of stability that happens at the structure of the bones themselves. So when we think about centration, it's mostly seen at the ball and socket base joints of the body. We can think about the shoulders, we can think about the hips. Ball, socket, it doesn't actually look like this, but what we have is a central line of tension where we have maximal surface area contact of ball and socket.
I got a treat for everyone listening. We got Dr. John Rusin back. Everyone knows who John Rusin is. He just came out with a brand new book. Actually, it's up for pre-sale, and you'll hear us talk about it at the end of the pod as to how to get that pre-sale and how important that is to what he's got going on. His book, Pain-Free Performance, it grabs all of his information. He has been putting out content for years on social media. He is the #1 course in the world in our industry. So check out all of his courses, but you got to check out his book, Pain-Free Performance. John and I go through how he evaluates athletes and then how he changes their lives, sometimes on the spot in his coursework, just by working on their setup in motion, just by working on muscle activation appropriately. More importantly, we dive into how he coaches it and how he gets the desired effect and movements out of the athletes in front of him. We get really nitty-gritty into the anatomy and the biomechanics and the physiology with given movements, but then we also kind of zoom out and talk about how do we apply all of that knowledge to those who are in front of us who don't speak our biomechanical terms. Was a great pod, was a great conversation. This one is totally worth the download. Please share it. I know you're going to want to. Follow us, True Sports PT, on Instagram. Let us know who our next guest should be. You guys are going to love this conversation. Without further ado, here's Dr. John Rusin. Welcome back to the True Sports Physical Therapy Podcast. Returning is a fitness legend. Dr. John Rusin, welcome back to the show, man.
It's great to be back on the show because the first episode was awesome. I have the opportunity to be on a lot of podcasts, and you were fire. You were bringing the heat. You're asking tough questions, but I listened back to that, and I was very impressed, and I got a lot of messages about how quality that podcast was, so I'm so happy to be back on.
Hell yeah. Well, thank you. I love hearing that. You're probably just saying that because you and I are brothers from a different mother, you know? Like, I think it's just because it's like looking in a mirror. So welcome back. You have some really exciting stuff. You got your book coming out. Right now it's on pre-sale. Pain-Free Performance is the name of the book, the name of the system, really. So tell me about what makes this book stand out from a very crowded marketplace.
Well, it's an exciting day today specifically because just this morning, I got a random package in the mail. I didn't know what it was. You know, we get a lot of Amazon Prime and things shipped to the house in boxes. And all of a sudden, I'm ripping open this thing and I'm like, oh my God, nobody told me this was coming. It is the first edition of Pain-Free Performance. It came right from the publishing house in Canada and it came from the printer. So before it even hit, I have the first copy, and that was this morning. So I'm flying high here in Madison, Wisconsin. I'm like, heck yeah. And I did a little bit of the math on it, and it was 2 years, 9 months, and 18 days to get that book and that resource in my hands for the first time. But it's been a wild ride to be able to have Pain-Free Performance, which is essentially the training system that I've run throughout my career. It is the certification course that I've run since 2018, over 1,000 in-person certifications delivered.
That's insane, dude.
And we finally have the ultimate resource in a different medium, in written form, but I think that this will stand the test of time because it's a track record of a proven system that simply gets people results, gets them healthy, gets them moving, but also allows them the freedom to diversify within any type of fitness or health specialty. And I think over the years, we've had a huge amount of success. And I think the book will speak to this, that this book is for everybody, not everybody, everybody. Because throughout the course and throughout my client management, I've had people from all walks of life. I've had youth athletes all the way up into extended age athletes. I've had people in their 30s, 40s, 50s, and 60s, people coming off of pain and injuries and out of rehabilitation at physical therapy, and people that want to push to their high performance levels. So I think that if your goal is to be healthy, to perform at your highest level, and to unlock longevity for the future, the Pain-Free Performance book, certification course, and system that is what we're speaking to, and this is who this is for.
I love that because you are expanding your market so immensely, right? This book is for everyone. So, how do you write a book with that type of audience in mind? You're not just talking to PTs, you're not just talking to strength coaches, you're not just talking to patients, you're talking to all of the above. How did you go about kind of getting that voice together to speak to everyone?
The voice has always been there because we've had eclectic attendance at our certification courses over the years. We'll have a great mix of personal trainers and strength coaches, physical therapists and chiropractors. We'll have Pilates instructors, yoga instructors. We'll have 3 to 5% of our attendees are physicians and medical doctors. So
That's
we
awesome.
speak to the movement system. We speak to the power of training and the power of preventative health care within pain-free performance. So I think that over the years, speaking to this audience in person live certification courses made it a little bit easier to go in and try to speak to the general fitness enthusiast. Somebody that simply wants to be able to be healthy and train for a lifetime because they've probably run into barriers, some roadblocks, some pain and injuries that have plateaued them, or they're just not knowing what exactly to do to put all the pieces together to see how they need to train for the long term. You know, it's easy to put a random workout together. It's harder to put a program together. It's harder to put lifetime programming together for extending your health and longevity. And I think that the cornerstones of many of these different physical endeavors, whether it be goal sets of health or goal sets of performance, is simply moving, feeling, and functioning well. Easy said, harder to do.
Sure. Sure. Yeah. It's difficult to do. So as you're going through that process, did you have trouble articulating to the exact audience? Like, I know you have experience speaking to a wide breadth of people, but how do you put that in written form?
We broke down every single section and chapter to try to weave in different anecdotes and stories that made it come to life. I'm one that I've done a lot of continuing education. I've had a lot of amazing opportunities to be mentored myself over the last 19 years of my career. And I didn't want pain free performance to be like the John Ego show because that is not how I am. And that's not how I've ever taught my system. What I wanted it to reflect was, where did this system come from? What was the origin story? What was the aha moment that made this modality fit within the higher level system? And why does it make sense? So we go through every single chapter and it has this lead in story and it places the reader in a bird's eye view down on me at one point in my career where I had these experiences that were crazy. I'm powerlifting with 1,000-pound deadlifter in Columbus, Ohio, and he's hoisting weight and I'm at like a third of his weight. And finally he says, "Hey, John, you need to learn how to brace." And I go, "I know how to brace." He goes, "No, feel this." Makes me hug him while he's all sweaty and hairy. And he breaks my hug by actually bracing his core, 360 degrees of tension and air recruitment. And I go, "Oh, maybe I don't know how to brace
That's a brace.
properly. And I
Yeah.
definitely don't have a system to be able to scale it to the level for everybody." So different stories that make it humanized, I think, hit everybody and entertain them. Because even my 10-year-old son, he ripped it open this morning and he wanted to read a couple of these stories because he's like, "Oh, I heard there's stories in the book."
Yeah.
And even him, he's like, "Man, I can actually read this." Far different than the textbooks that you and I went through at Doctorate of Physical Therapy school. You know,
Yep.
very dry, very mundane, and you can barely get through a chapter just to test out at the end of a semester. So we tried to make it real right away. And then we layered in different methods and tactics that were multi-medium. So every single time that I go in and I teach something, we have some amazing visuals. We have over 1,200 creative assets. And then every exercise, movement, screen, and assessment has an individual QR that leads directly into a proprietary playlist that only the readers have access to. So you can see the motion. That is a far different experience than any other textbook that I've read.
That's super cool. One of the huge positives I get out of taking in-person continuing ed is learning from the instructor of how to cue different things. Like you just gave an example of how do you brace, things like that. Give me some
Yeah.
examples of the cues which are no doubt spliced through this entire pain-free performance offering.
Well, so we do a combination of different cueing. How to get started is essentially a biomechanical cue on proper setup. Setup is going to be a key for almost every exercise with every movement pattern for every single person that is indeed training. So being able to have just a base proper setup in order to then maximize upon some of the principles of cueing, which is going to be bracing, breathing, and scale of tension. Those three things get us 80 or 90% of the way there. And it has throughout my career. And I think that's something that's very interesting because everyone's looking at trying to cue or coach the dynamic movement. They're trying to coach as you're concentrically lifting out of a squat, or they're trying to control the eccentric on an RDL, and they're trying to coach as the person's moving. At Pain-Free Performance, we'd have a better amount of success making sure that we're maximizing the controllable variables before we actually start moving. If we can set up properly, if we can scale tension, if we can brace and we can breathe, the likelihood that we can move with a quality pattern that looks good from the eyeball, that feels good from internal tension standpoint, and that doesn't elicit a pain response is far higher. So we have combinations of setup cues and then also tactile cues, which we can actually get hands on, we can get bands on, we can get feedback from the ground, the rack, the floor, the wall, just to be able to have somebody reacting into space. And then also we have a huge amount of emphasis placed on our clients moving with internal tension leading their movement system, meaning that we want them to feel and generate their muscular contractions, their key stabilizing muscles working properly, and their concentric action takers where we can have a strong mind-muscle movement connection. In terms of proper bracing and proper stability and setups, and being able to move with pain-free nature, we want people to be self-autonomous with that. So a vast majority of their cueing are going to be hands-off, but it's going to be internal tension driven. It's going to be internal cues, especially upon those setups.
That's really a great way to look at it. Like the setup drives 90% of the success. I've never really thought of it like that. So that's an awesome tidbit. And it sounds like your book really gets into, first of all, this is a great conversation because I don't have to pretend like I read the book because I can't get the book yet. So it's awesome. So we're talking about something that I could not have read, but it gives you a great opportunity to spell out exactly what's in the book. And that setup is something that we talk about, I think, in our field, but not enough. It's definitely not the biggest point of emphasis, but it is here in Pain-Free Performance. I love that.
Well, it's not sexy. So when you're talking about, so the first section of the book is all about the pain-free performance tenets. It's essentially our principles that will remain true for whatever you do, whatever your physical endeavor is. And this goes on to a movement mastery mindset of actually respecting movement, wanting to master movement, wanting to be able to diversify your human movement system spectrum, and be able to simply peel back the onion on what your body is capable of. Movement mastery mindset is up here, and that is the first chapter. And then we go into a robust breathing and bracing 2 chapters after. And that allows us to be able to set the stage on the bare minimums of being able to be safe and effective with the movement practice. And this comes from my coaching, my consulting, and some of my rehab and therapy background. Because as a coach, I need to make sure that we have a base level of knowledge and also action in terms of our clients and our patients being able to stay healthy before they start training. This isn't a huge and robust 2-hour assessment. This is making sure that they can breathe, making sure that they can brace, and making sure that we have a conversation about us exploring their movement together with me guiding their process. And that's something that I've done my entire career. And I thought it was extraordinarily important to have that same feel, just as you were to come in and work with me personally, right inside of that first section of the book.
Yeah, I love that. You know, we when we got on this call, I was giving you crap about going from PT to strength coach, and God, based upon your beautiful confines up in Madison, Wisconsin, I wish I would have been a strength coach instead of a PT. But you're not actually a strength coach. You're not actually a PT. You're a movement master. That's a totally different lens through which we should view what we do for a living. Whether you're a PT, whether you're a strength coach, we got tons of them listening. By the way, whether you're a physician, you are a movement expert. And when you look through that kind of lens, it kind of guides the way we should approach a given exercise, but also our profession, the way we interact with individuals, like get us out of this small box of I am a PT, so I have to treat injury. No, I'm a movement master. I need to teach and coach and understand movement. It really flips it on its head. I love that. You mentioned, I understood a lot of what you said. Scale of tension, I did not understand. So dive into
Yeah.
that world.
Yeah, let's go through this. It's very cookie cutter, black and white when it comes to breathing and bracing within our fitness and our rehabilitation industries today. Really on one side, we have, hey, don't worry about breathing, don't worry about bracing. Your spine, your shoulders, your hips, your knees, your Achilles, they're all super robust just because you were born a human being. So you go out and just do whatever the heck you want to do, and we'll callous the system just by exposure and load. Okay, that's one side of the spectrum. The other side of the spectrum is like, hey, we are going to pick up this pencil off the ground like we are deadlifting 900 pounds right now. We are going to set our pillar. We are going to brace maximally. We're not going to breathe at all because breathing is bad when it comes to spinal stability. And we are going to do the heaviest Valsalva maneuver ever to pick up this pencil off the ground. Both are mismatches in my mind. At Pain Free Performance, we try to get the bullshit out from either side of the spectrum and go to the middle ground where people can actually function. And scaling tension essentially means that we have the ability to have a dimmer switch, not an on or off switch in terms of our body's internal tension base. Internal tension is going to be driven by the pillar complex, the shoulders, the hips, the core, working as the trifecta of tension. We want to be able to spiral this tension. We want to be able to have multi layers of this tension in terms of musculature, in terms of bony anatomy being able to be centrated, and also to be able to have fascial slings lining up in the right direction so we can actually get the deepest level of stability, which yields strength, which yields power, which yields our ability to hammer muscles while sparing joints. But I think that it is activity dependent, it is individual dependent, and it is also based on somebody's particular skill set. So when we go in and we start to teach bracing, we want to know what our 100% maximal recruitment of tension and irradiation is throughout the body. One of the biggest mistakes that I see people make is that they think that they're at 100%. I've been there. I was there with a sweaty powerlifter,
Yeah.
and I was at like 50%. I didn't know my potential at 100%. And then when I went to scale down my tension, I was actually scaling it down from 50 down to an actual 20 or 10% of actuality. So I think that being able to define where that 100% of tension is, that's the entry point into having that movement mastery mindset. But we're not going to be able to brace and scale tension the same way doing a 1RM deadlift as we are a 25 rep per side Bulgarian split squat with dumbbells in our hands. It just needs to be a different mechanism because as scaling of tension goes up, our ability to breathe goes down. This is on a sliding scale. So when we think about matching the demands of a task with the demands of your tension, we need to have not an all or nothing, but we need to have the minimal effective dose of tension and muscular recruitment throughout the body that allows us to still keep quality form, be able to have proper repeatable technique that is fatigue proof, but also allows us to be able to exchange air and actually tap into some of our ability to move without a restrictor plate always restricting the way that we're able to move through space, through range of motion, or even be able to toggle into things like lateralization and rotation of movement. So really, we need to think about defining what 100% of tension is, scaling it down to the activity at hand, and then being able to maintain that level of tension for that specific task.
It's really interesting. I love your euphemism for breathing of exchanging of air. It's really an interesting way to think about it. Like if we don't know what our maximal tension is, how are we going to be able to find that happy medium to do it for a long time? You used a lot of words that I understood. Centration. What the
Yeah.
hell does that mean?
Centration is a central line of stability that happens at the structure of the bones themselves. So when we think about centration, it's mostly seen at the ball and socket base joints of the body. We can think about the shoulders, we can think about the hips. Ball, socket, it doesn't actually look like this, but what we have is a central line of tension where we have maximal surface area contact of ball and socket. From the deepest layer this bony prominence together allows us to be able to be stacked in terms of a biomechanical perspective. When we are centrated, we have the better ability to transfer force throughout our body, either from the ground on the way through the pillar or from the hands down into the pillar and back down into the ground. That's kind of the way force works. But
It's
when we're
really
thinking,
John. It's amazing to think of it like that. I mean, I think if you were reading a textbook from when I graduated from grad school, that would be called a closed pack position of the joint, right, where you're getting maximal um, I'd say exposure between the surfaces. So I love the way you think about that from centration. And by the way, it bleeds into your previous career as a baseball player. Like thinking about
yeah,
generating the maximal amount of force from the ground up has to happen from this closed pack position. I'm just thinking of like a pitcher moving through like that beginning phases of his windup. You're allowing those joints to close so that you can create stability upon which you can then rotate and explode out of. Is that a decent summation?
it's a combination. So we're on the
Okay.
right track here. So the closed pack position will be forced in terms of being able to use your word, wind some of the soft tissues and force the joint into a non-moving position, like internal rotation plus elevation plus scapular elevation and upward rotation of the scap. That would be a closed pack position of the shoulder. We're looking at actually getting the perfect open pack position of the shoulder and then allowing some of the soft tissue, the intrinsic stabilizers, using the shoulder as the example, the rotator cuff, actually acting with a length tension relationship that makes sense and actually recruits deep layers of stability. And then some of those secondary and tertiary stabilizers, the pecs, the lats, the deltoid insertional points, to allow us maximal muscular recruitment to take that open pack position, recruit around it, and then allow maximal degrees of freedom, maximal range of motion, but also be able to have, again, the joint sitting from a bony anatomy perspective where we want it for force transduction.
Okay, love that. I think that really lands to the PT listeners, right? To the
For sure.
PT side of your audience, the strength coach side of your audience. How do you take all of that mumbo jumbo and make that easily digestible to the athlete? Like
Yeah,
when
so
when
going
you're lining up for a deadlift, how are you coaching centration?
Yeah, before we even line up for the deadlift, we want to be able to teach the way that we want to position and we want to set up and stabilize, going back to some of those first principles of pain-free performance. Really looking at the shoulder is a great example because you can see it on camera with me right now. You look at being able to have tension and recruitment happen in a centrated form at the shoulder based on some of the muscles that we can simply palpate. If you go into your pectoralis group and you can go into your lat, so I go hands, fingers on my lat, thumb on my pec, and all of a sudden I can start feeling some of these muscular contractions happen. Now we have all these like really poor cues when it comes to setting up for success for pain-free performance in the industry. Get your lats tight, or spread the bar when you have something in your hand, or
Yep.
maximize recruitment of your grip. But in all actuality, to get centrated, we need to have a combination in rotary force with the anterior chain, the lateral chain, and the posterior chain all working together. So something like the pecs and the lats, they're secondary internal rotators of the shoulder. So in order to get us into a centrated position automatically, we'll have recruitment of the pecs, recruitment of the lats. You'll see automatically that my shoulder will depress, it will slightly internally rotate, and I'll actually sit the scap very nicely on the backside of the thoracic cage. These are things that we can feel. So we want people to be able to feel the lines of tension and their stability before they even go to move. The last thing that I'm doing if somebody's lining up over a deadlift is like, hey, you feel this and this and this. They should already have the tools to go in and do that. So that's why in section 1 of the book, it's like we're trying to line them up with these tools because no matter if you're deadlifting or squatting or sprinting or doing a Bulgarian split squat or push pressing overhead with the barbell, you're going to have the same mechanical properties of performance. So lining somebody up for that is really big, but it's going to be different for everyone. Everyone's bodies are different. We have different limb lengths, we have different joint types, we have different joint structure, we have different insults via previous injury. And I think that we just need to be cognizant that not everyone's going to look exactly the same, but their experience with being able to move, create tension, scale tension, and then be able to perform pain-free can be the same at the end result.
Yeah, I love that. I love that mindset. Okay, so with all that in mind, you kind of coach, you have the conversation with the athlete. Here's what a centrated shoulder kind of should look like. More importantly, how it feels.
I would never use the term centration with an
Okay.
athlete or a client. I would just be talking about getting tight, staying stable, using simple words that they can feel. And then taking that word that I'm using, use repetition with it with the way that they're feeling whatever they're feeling. If we have success at the shoulder, we go down to the hips. If we have success at the hips and the shoulder, then we go to the core. If we can line up all three, we know that we're going to have a huge amount of success and then being able to move very well.
Awesome. Okay, what does that look like? What does a centrated hip look like?
Centrated hip is an interesting one. So obviously the hip doesn't have the same degrees of freedom as we do at the shoulder. It's a little bit more strict, and obviously we have some things to manage differently than the shoulder. Shoulder complex is called a complex for a reason. Mainly you have the scap and you have the collarbone, which totally changes the games in terms of biomechanics. That's for the good and for the bad, but when it comes to the hip, it's far simpler. Hips are a combination of flexion extension, internal and external rotation, abduction, and adduction. Now, these are all textbook origin, action, insertion, innervations, and
Yep.
that's not actually how the human body functions or how it actually
Yep.
moves through space in the real world. Every new DPT, every new graduate of their undergraduate program, you'll learn this and it's going to
Yeah.
be a tough one. You're going to be like, oh, that's not exactly what I learned. It's a synergy, right? So when we're looking at the hips, we want to be able to have the first line of tension be able to be two key areas. We want to be able to create torque and we want to be able to create centration out of the adductor group, combining with tension with the glute group. The adductors medial, the glute group is going to be posterolateral, and the combination of being able to create that torque off the ground and our strong foot placement on the ground allows us to actually centrate very well. Now, this becomes more and more important at the lower body for hip centration and more of a squat dominance on the lower body training spectrum versus a hip dominance. Hip dominance is very easy. We go into a lot of flexion, a lot of extension. We usually have a static knee position anywhere from 15 to 45 degrees in order to keep the hip dominancy front and back on a hip hinge. But when we look at a squat pattern, this is actually the way that centration makes a difference in terms of your range of motion, in terms of you avoiding things like hip pinching or the glass ceiling of hip range of motion when it comes to actually getting the squat. It's the combination of all those positions that I mentioned at the hip in combination with being able to explore ankle and also knee ranges.
Yep.
So it is an interesting one because it's obviously closed chain, but we have a lot of moving parts. And I didn't even mention what is up chain, which is the lumbopelvic complex.
Yep.
So when we get into hip centration, pain-free performance offers an entire chapter, it's about 100 pages, on the squat specifically. We deep dive into the way that I teach the squat right off the bat. And then, hey, things didn't go very well on that squat. It either elicited a pain response, it didn't hit our base metrics of range of motion, or it didn't hit our key criteria of movement optimization, which is symmetry, kind of the same right to left, stability, which is not lagging on any key form at the spine or at the hips, and also our ability to remain neutral. So in a screening protocol, we probably should look pretty good. You know, you have minimal to no weight on you. We're going down through that screen. If something happens, we're like, you know what? We need a closer look and a more detailed data drive on why this didn't look so awesome. We go into something called the hip quadrant test. The hip quadrant test is a key maneuver that allows us to explore essentially the bony anatomy for the glass ceiling of where somebody can squat. Now, we're not talking about a barbell back squat for everyone all the time. We're talking about the squat pattern as a functional human movement for life. And we're able to take the hips and put them into that open pack position, put tension around them, and allow us to see how much hip flexion, what's our knee to knee distance, what's our foot abduction, and most specifically, what is our floor to butt distance to look at what is our ideal squat stance so you can actually explore your full range of motion movement.
Love that. Okay. I love it because it's so individualized. And that's one of the struggles that we get when we're just living textbook is applying it to anatomies that look vastly different. So walk me through yeah, it's crazy. Walk me through that quadrant test. How do you test it? And then how does that key you into your ideal form for a given movement?
Yeah, so the first thing is just to do a control group like, hey, show me how you squat. So we'll have somebody set up in their own squat and they'll go down and through. Usually we'll do 3 to 5 reps, let them grease the groove a little bit. We're not necessarily coaching here. We're just actually observing in terms of screen. We don't actually tell our clients and our athletes that we are screening them. We feed this into the 6-phase dynamic warm-up, a specific phase where we can kind of like check box whether the plan is going to go today in terms of their training or whether we need to make some movement adjustments or coaching adjustments. But when we get them into the quadrant test, this happens with a client down on their back. They're essentially bringing their knee up to their chest and they're trying to get maximal hip flexion off the bat. Now, the goal is to get the kneecap as close to the chest as possible with a neutral spine and with the opposite leg laying down lax on the ground in order to make sure that the pelvis isn't rounding over, we're not compensating, we're not rotating, we're actually getting some decent data. So step 1, bring the knee to the chest. Step 2 is a little bit more nuanced and takes a little bit of a greater feel. And that's why a coach will be dictating how we actually explore this, is that we start to add abduction of the hip and rotation externally of the hip in order to see if we can actually get the knee a little bit closer to the chest. So our big goal is to get that chest to knee distance as low as possible. So we do that on 1, and automatically you'll see that we'll have a knee out position, we'll have a little bit more a narrow or a wider stance at the feet, and then you'll see the abduction angle of the foot as well. So we keep 1 up, we do exactly the same thing on the opposite side, and then all of a sudden, we are about to deliver a baby on the training floor, ready to roll. And yeah, I mean, that's the reality, but you do this like once every like 6 or 8 months. It's not a huge deal or a time zap, but when we do get them down into this position, this is when I do get a tape measure out. We're not using goniometers, we're just using a simple tape measure. We're taking a couple key positional measurements. First measurement is going to be the knee to knee distance. So basically, how much abduction did we get out of that position? The second one that we're going to get is a heel to heel distance. So their feet are going to be up like this. We're going to be going heel to heel, mid of the heel, and we're going to be able to have that. The next one is going to be a toe to toe distance to show the toe abduction. And then the final 4th measurement is going to be basically like a glass floor underneath their feet, you would have to imagine, and you're taking that all the way to their butt, and that is your butt to floor distance. And then we like to be able to do a magic trick, especially in the 2-day certification courses where we stand people up. We go, here's your new squat stance. And I would say 50% of the time, it's like, oh my God, they just saw a huge market improvement. We've had people from 17, 18, 19 inches of increased authentic range of motion in the squat, right live in the course in front of everybody. We've also had people that were like a baby giraffe, like, oh my God, like,
Not used
I
to
don't
this.
even think I can stand in this position. Usually that's going to be like the competitive power lifter that's been in one certain stance that's usually a little bit more force-fed and dogmatic, or it's going to be the Olympic lifter that is super used to using compensations for performance enhancement. But the average people, vast majority of them get up into their new stance. Obviously, they need to practice it. They need to load it. They need to scale it. They need to build the requisite amounts of skill and exposure to be able to be good in that position, the rule of specificity, but automatically they feel a lot more free. They feel like they're allowed to move their knees forward. They're allowed to move their knees out or in. They're allowed to be able to sit down with a neutral spine. And it's almost like when it goes well, boom, they go right down into a position that feels freed up for them. And then the second thing that they'll say is like, hey, first thing, man, this feels pretty good. Second thing, they go, I don't necessarily squat like this.
Yeah.
And then the next conversation is, hey, how do we program this? And how do we make sure that we can maintain this sort of squat while actually training for your goal set specifically? And that's where the programming structure comes in on how to maintain an authentic foundational squat pattern while training specific squat variant exercises in order for their specific goals.
Okay, so when that is fascinating. So you're taking these tape measure measurements and then you're standing them up, putting them on the ground, and you're trying to mimic the measurements you just saw in supine in standing. So what do? You lay out the tape measure on the floor?
Absolutely. So we'll tape measure the floor, or if you're on a gym flooring, you can actually just use a chalk measurement. I do this a lot with my athletes that if we are just working on them being repeatable with that new squat stance, the thing that we can always manage right off the bat is, again, our setup. So we are able to chalk the floor right in the squat rack, and they're able to step back into that position.
Okay, that's awesome. And then how does that translate once you go unilateral? Say you take those measurements, then you go to Bulgarian, or you just how do you do that?
Well, it's a whole new movement pattern. So the six foundational movement patterns, we have squat, hinge, lunge, push, pull, carry. So the squat is a bilateral squat, what we just talked about with the quadrant test. The whole game changes as soon as we go asymmetrical lower body stance. That is our lunge pattern. Our lunge pattern can be thought of as a combination of the best attributes of the squat and the hinge simultaneously. But where we go wrong with the lunge is that we treat it like a single leg squat. It's just not that mechanically. As soon as we offset our stance of the lower body, whether it be a split squat variant, whether it be something like a Bulgarian split squat where we change the stance and also the elevation, or whether we're traveling the body forward on a step, laterally on the step, behind us on the step, behind and behind our back with a curtsy step, there are different properties that allow us to be able to be strong and stable because essentially we have a dominant leg and a non-dominant leg when it comes to these asymmetrical setups. So we get people where there's a combination of mobility, stability, skill, and then skill is essentially balance in this position. But
Yep.
this happens to be one of these ones that, in my opinion, is hugely misprogrammed and misexecuted. It all becomes about, hey, it's just muscular targeting. And we forget that all function, especially on the field, court, and daily life, happens in single leg or asymmetrical lower body stances. I think I saw a recent study that was over 91% of all athletic movements happen in single leg. So it's like, oh, that's the polar opposite of what most people are programming for in terms of their volume distribution.
Yep.
But when it comes to the lunge pattern, we want to be able to maximize knee forward and we want to be able to maximize the hip hinge. We want to do these things simultaneously and we create our strongest and most stable position of any of the lower body patterns.
Okay, that's awesome. By the way, it reminds me of I'm working with a NFL fullback now, coming back from a calf strain, and so he tears his calf. 2 weeks later, he goes back to try to run, blows it out again, and in trying to dissect what it is his rehab and strength and conditioning protocol looked like to that point, there was none of this single leg work. And you're telling me it should have been 91% single leg work.
Uh, Maybe not 91%.
Okay,
That is
but
what you would do, like for like, hey, he's actually on the field. 91% of the time, he's functioning out of a single leg
but
stance.
that's what it should. But that's what it should look like in the gym. I mean, maybe
I
not
would say
exactly
that
91%, but
it should be far more emphasized than it is. You know, if you want to play the game of equals, you have the squat, hinge, and lunge as the lower body directed patterns. Really smart programs, if I go through an audit, will have a 33% distribution of all. But most likely, it's not just everyone just the same avatar. If you have a background of bilateral squatting and hinging a shit ton, we need to actually bring up the volume and the exposure to single leg asymmetrical stances even more. So for a vast majority of athletes that I'm working with, it's probably like 50 or 60% of their lower body directed work has a unilateral emphasis.
yeah, I love that. And would you say the same thing would apply to upper extremity?
It's because of the freedom of the shoulder blades, we have the ability to do bilateral work with the degrees of freedom at the hands in an open chain. So that's a little bit different than the lower body. So the scaps kind of change everything, so to say. But I
Yep.
do distribute in a little bit more even. It's probably 50-50 in terms of bilateral and unilateral motion with the push and pull patterns.
Gotcha. Okay, that makes a lot of sense. I love the way you think about it. I wish I had a T-shirt that had those foundational movements on the back of them. Do you know where I could get one of those? Yeah, there you go.
Yes, yes. Painfreetraining.com. You can go and grab one of those and you can actually sport what you believe. But hey, I want to tell a story because you have this client that is the NFL fullback, and he's dealing with these calf injuries. And most likely, he's not actually exposing his lower leg to any sort of isometric stress at the soleus, at the gastrocs, working from a shortened position, really from his foot intrinsic stabilization. That is the magic of single leg training. I was doing a consulting job a number of years ago. This is like 6 or 7 years ago. And I was working with like our royalty here in Madison, Wisconsin, which was the Wisconsin Badgers football team.
Yep.
And strength and conditioning coach was an awesome guy, like somebody that I hugely respect. He had an NFL background. He played in the league for almost a decade. And then he came back up and through the ranks and actually came back as their strength and conditioning coach, and then moved on to actually being positional coach. And now he's a coordinator at a different place. So really great guy. And we were looking at the way that he was distributing volume, just like we're talking about right now, in terms of lower body directed patterning. And all of a sudden, like, it was very clear that there were no split squats and there were no lunges. Smart guy.
Yeah. How do you miss it?
Why isn't this in here? And it became this big debate within his athletic training staff with his strength and conditioning staff, that they had some new emerging research out of the Research One University, which is University of Wisconsin, saying
Obviously.
that by splitting your stance into a split squat, you are putting the Y ligament at increased risk for hernias.
Okay.
That was the only time I've ever heard that. That is the
Yeah.
only time I've ever heard that. And it actually dictated the way that the off-season training went for that specific team on that specific season. And I always have to say, it's like, you have to look at the success. You have to look at the common sense practices of being able to match demands of sport or activity with what you're doing in the weight room, and being able to strengthen just foundational patterns, and maybe not neglect things based on one piece of data or one study and one piece of literature. And that always shocked me, because we had the conversation years later after he left that program, how stupid that actually was. We're like, man, if there was one thing to do, it was actually that. And that was the one thing that wasn't getting done. And that season wasn't awesome for the team, because they had a lot of non-contact, otherwise
Soft
preventable
tissue. Yeah.
injuries that happened specifically at the hamstring, specifically at the adductor in the groin. And they did have a number of lower leg injuries. All of those things are hit from a different and a novel perspective with single leg training.
Yeah. How did you get that strength coach to be open-minded enough to react to your information? Because what I run into a lot is, dude, this doesn't make any sense. Why don't we try this? It's like, well, no. This is the way we do it. So I don't know if it was a personal, like a specific thing to this strength coach, but how did you get him to have that open growth mindset?
I think his experience of having played at a high level, having trained, he had common sense. He had common sense, and he was being pulled one direction, and he was going to push back at another. He just needed the
Yeah.
last push from a consultant to be able to say, "Hey, I'm feeling good about this." But to be perfectly clear, they didn't make that decision right away. It wasn't like, "Hey, I came in, and the next week they had split squats." That's not how it went. It took about a year to be able to actually funnel that back through, because it is a bureaucracy when it comes to the high level sport. There's a lot of hands in the kitchen.
Yeah, no question. Oftentimes to the detriment of the athlete. It's really unfortunate. Okay, so also, that was an awesome clinical deep dive. Gave me a great understanding of pain-free performance, the book, but also the training system and the way you're implementing it. More nuts and bolts, or like on the business side, maybe. What
Yeah.
was the moment when you said, "Hey, I need to write a book and put this down in old school formulation from your usual social media based production"?
Well, it was never something that I had the goal of doing. I think sometimes you talk to authors and they're like, "Oh, it's my life's goal to be able to have a published book with a reputable publishing house and getting it out to the masses." I've had my head down for, a decade and a half at this point, just doing what I do in terms of coaching, consulting, teaching, and educating. And it didn't really even cross my mind to be able to create a resource, let alone a 574-page textbook written for mainstream media. Like,
Yeah.
that never crossed my mind. But I'm a huge consumer of continuing education. I'm an avid reader. I think one thing that we do in the Rusin household is that we train, we play sports, and we read. And my son, I proudly have him reading a ton as well, and he loves it. I think it's a product of his environment. But having read so many different books, I read everything that comes out. And I was a big fan of large scale media. Not the tiny little books or the self-published books, but when a book comes out that is a couple hundred pages, it has multi-level touch points in terms of graphics and different charts and things like that, I'm a huge fan. So I've been a fan of Victory Belt publications for about a decade now, because the people that I came up learning from when I was an undergrad, when I was working as a Division I strength coach, when I was in DPT school, these are the books that I was reading. These were the authors that I was reading their articles on when people used to write long form articles online. This is who I was learning from. So I was a very big fan of many of these different authors, but I kept on seeing the same byline on these books. And it was like the author that I knew, and then this dude, Glenn Cordoza. Well, who the hell's Glenn Cordoza? Because he's writing these awesome books that are lights out. And I think it was like 2017 or 2018, a colleague of mine, Brett Contreras, the glute guy, he wrote his book with Victory Belt, which is a huge resource that's probably just as thick as mine is. And it was the Glute Lab, and it was Dr. Brett Contreras and Glenn Cordoza. So I was like, finally, I need to know. I was in Brett's gym in San Diego training with him. And I was like, hey, how did it go with Glenn? And how was the book writing process? And like, how did everything go? And he said, I couldn't have done any of this without the support of the right publishing house and the support of Glenn Cordoza, because he made my education and my training systems come to life. And he gave me a piece of advice, and this is a while ago, I'm dating myself, but he said, wait for the right co-author, because it will make everything come alive that you're already doing well at. And that weekend I went in, I taught my 2-day certification course in San Diego. Brett came in, was a part of the panel, and that stuck with me. That stuck with me for years. And then 2022, Thanksgiving Day, I get a random call from a Las Vegas number, and it was Glenn on the other line. It's like him and I, like guys like us, we don't have lives. But I was down in Florida with my family, trying to celebrate, trying to unplug a little bit. It didn't work, because he was on the other end of the line saying, hey, we love pain-free performance. I was at your course. I'm training on your programs. This is the next book, and I'm going to take it on as a co-author. Do you want to write it with me? And naively, I was like, yeah, like, let's do it. You know, I heard great things from Brett a couple of years ago. That book came out awesome. I was a huge fan of it. And I agreed right on spot to write this book. I had no idea what I was getting into, but I think the driving factor for me to be able to go in and do essentially the hardest thing that I've ever done in my life. I've done a lot of hard things, but I would say that mentally, emotionally, psychologically, and sometimes physically, getting pain-free performance to print and then off into the shelves is going to be the project of my lifetime, because we have so much time and dedication into making something that will stand the test of time. And the driving factor became more and more, how do I support, one, the coaches that have already come in and got certified by me in pain-free performance? How do we give them the ultimate resource where they don't have to go in and Frankenstein their resources together from everything that I've done? I want it all in one spot. And then secondarily, it's like, how do we get this out to more people? How do we actually penetrate the mass market that needs this more than ever before? Because if you go out into the real world today, people are struggling. They're not only struggling with their weight, they're not only struggling with their mental and systemic health, they're struggling with their orthopedic health as well. The average person that comes in to work with me is dealing with 2.3 chronic pain points that we need to figure out a solution to, one, train around, and two, being able to rebuild. And that's something that isn't going to get any better if we don't start making changes. So when you have the opportunity to go in and distribute your life's work to 1 million plus people, all places worldwide where books are sold, sign me up. It was a huge driver forward. And I think that there was some legitimacy, even if this is made up, there was some legitimacy of taking something like the most successful 2-day certification course in the last decade here in America and being able to put it into a book with a byline and be able to have it and sit it physically in somebody's home. I think the real estate of being able to have something on the coffee table is worth its weight in gold because it's often a reminder to be able to stay on track with your training.
Yeah, it's amazing. That's amazing. Well said. And kudos to you for doing it. What was the actual process like? Like when after that phone call, where do you start and what does it look like a year in?
Okay, so where does it start? It starts with Glenn going through and starting to audit course after course after course. Because the original thought was, hey, we have the entire curriculum. It's really vetted because we've given it so many times with a high level of success. We're going to simply take the course and take all the curriculum and take all the recordings that we have of you. And then Glenn's going to go in and listen to you do more courses. And he's going to create the transcripts and everything will be good.
Yep.
That was the first 6 months. And all of a
Yeah.
sudden, we're like, no, the course continues to evolve. John continues to evolve. We continue to refine, and we wanted to be able to plug all holes that were in the live course that we couldn't necessarily address questions that came from the audience, or we couldn't dive into deeper topics based on the individuals in front of us. So we had to make a massive resource to be able to hit all people well. So there was really no big burning questions, and they could simply have ease of use of the resource itself, whether that be jumping into the training programs, whether that be screening out their hips, or whether that be going in and putting together a pain protocol with a 6-phase dynamic warm-up sequence. So very quickly, we had 6 months of like discovery and education that turned into the next 18 months of Glenn and I spending anywhere from 12 to 16 hours per week on calls just like this that went through transcript to be able to go through every single aspect of what we are teaching at Pain-Free Performance, transcribe it, and then add to it. And then from there, we were taking chapter by chapter and being able to add, cut, and then improve. And every chapter would take a number of months. And it was a very arduous process to the point where we got to the end, and some of the last stuff that we did was the last introduction, or it would be the first thing that people read, and then also the programming section, which is about 120 pages. We feature 5 programs, 12 weeks of each and every program, and we have exercise variants and optionality throughout. So that was a heavy lift to get that off, but that was the last thing that we did, and we finished that up only about 5 or 6 weeks ago before it went to print.
That's okay. That's insane. Also makes me want to get the book because I'm fascinated by like the different progressions or scaling of every motion that you say is in there. So that's amazing. What a great selling point. When I don't know, 12 months in, there had to be days when you're like, dude, this sucks. How did you handle that?
It did suck. And I think some of the biggest stress was that Glenn and I are both perfectionists. We're not here to just create something, we're here to elevate what is ever been done in this publishing house. And I think that the pressure of wanting to create something that stood above all else probably led to the best work that I've ever done. Glenn said it's the best book he's ever created with 18 bestsellers,
Wow.
and the publishing house saying that this is the most detailed and comprehensive resource that they've ever done in 2,000 books. So I think the pressure led to a lot of stress, like a lot of sleepless nights, but I think ultimately a great resource. But one thing that I didn't stop was I run 4 businesses. I'm the CEO of 4 highly successful businesses within the fitness industry. And I kept grinding on those 4 while
Sure.
trying to find 16 more hours per week to be able to go in and write and improve and transcribe and be able to create, even down to the littlest nuance of a graphic. And that's why I think that it was a trying 2.5 years to get this off. But there were times and places where I was never ready to quit. That was never even an option. Once you start something, you're going to go through it. And you're not only going to go through it, you're going to make it the best possible thing to hand on to your son and to your staff and to your certified coaches and to your community. So I think that was a huge driving factor. But at the end, when the book did indeed go to print, Glenn went to Lake Tahoe for a week and turned off his phone and computer. I went to Hawaii and tried to unplug a little bit, and we were about done with it. But it was hard to manage that to get it off like that. And honestly, like everyone says this, and it's super cliche, But it was the hardest thing, and it probably will be the hardest thing to date that I ever have had to face and
Un-
do, because there was so
until your
many
second
false
one,
stakes.
until your next one. It's coming. I know it's
Yeah.
coming. I can tell. You can't turn it off. Also, I noticed like Glenn goes away, Lake Tahoe, he turns it off. Then you said, I went to Hawaii and tried to turn it off. So I bet you there's another book in that bald head of yours.
There is. Well, we do
Of
have
course
three
there is.
courses. So we have lifelong performance programming certification, which is super hot right now. And we also have the functional kettlebell training certification, which is the second biggest provider of kettlebell education in the entire world. So there is definitely more behind it. But I do think that we open the door in pain free performance, especially these robust programming and these follow along chapters where people will want more when it comes to, hey, I got my screens down, I got my assessments down, I got my preparation down, I got my pain-free fixing down, I got my programming structure of progression and regression scales for our movement patterns, and now I have all these programs. I think the next question for people is going to be, well, how do I create programs like this? So I think
Yep.
that there is going to be a runway, futuristically. I think we need a couple year break, though, if I'm being completely honest.
It's not gonna be a couple of years. From what I've learned from you, it's not gonna be a couple of years. I can't wait for that one to come out. But let's first get this one out. Now, you've done an amazing job of tackling the E-Myth. The E-Myth was the first business book I ever read. I was in graduate school. It talks about the difference between working in the business and working on the business. You just said that writing this book allowed you, even while you're in the business of doing your other four amazing companies, this allowed you to work on the business by creating this amalgamation of information. What did it open your eyes to when you started to work on the business? What did you say, hey, I never thought about this, I forgot about this, as you're moving through all of your coursework to put together this book?
I think it had a huge impact and a trickle down effect into the other businesses I'm running and operating. Because when you have the goal of creating an evergreen resource, which is something like the mainstream textbook, there's something special about that, that you do the work and you build the systems and you're able to give it the runway and allow the flight path to go off and allow that thing to essentially sit on autopilot. That was the assumption, but
Yeah.
that's not the reality of today. Pain-free performance was an interesting one because in 2018 I was a one-man show and I was traveling anywhere from 38 to 45 dates per year, and I was going out and hammering these 2-day certification courses all across the world. It was essentially the John show, and there was nothing wrong with that, but I knew that that clearly wasn't sustainable. After about 2 years in, after a trip, I ended up in the hospital back in Wisconsin just because I was so burned out. So having the right people around and being able to scale, that has been the goal over the last 8 years for pain-free performance. I have a great staff. I have a staff of 10 master instructors, and we scale over 100 courses per year. And
Amazing.
the goal has always been to be able to make pain-free performance something that stands on its own, and it
Yeah.
does today. But when it comes to the book, I was challenged, especially with our publicist, especially with our publishing house, and the way that the industry is moving, the way that the world is moving, is that you do need to be an expert, credible resource out there with your face in the camera today, with your face out at the events, because this is the only way to differentiate AI from actual expertise. And I think that moving forward, I've worked the last 8 years to be able to take myself out of pain-free performance to allow it to run. And it absolutely does that. And it does more than run, it dominates. But moving forward, I do think that as much as I'd like to work on the business instead of in the business, I will be working in my businesses until the day that I shut it down. So I do believe that this is going to be the future, for better or for worse. You do need to be a vocal, practicing what you preach steward of whatever you're doing, whether you have a physical therapy practice, whether you're a practitioner in somebody else's practice, or whether you're going out into the online space and trying to provide education resources, programs, and curriculums for people. You and your expertise and your story and your unique background, as I found, especially writing some of these chapters, it is the differentiating point that can allow you to take things to a whole new level and a whole new stratosphere. And as much as everyone believes that, hey, I'm just going to go in and like work my way out of the business and sit and drink Mai Tais in Bali, I don't think that's the reality, and I don't even think I would enjoy that at this point, because being in working on the business turned me into working in the business even more than ever. And I'm excited to get out there even more and be the business moving forward. So, as much as that is different than what I thought in 2022 getting into this, I think the reality of 2025 is that you better get your ass out there and you better be able to get your credibility and your education out there in front of people and be able to be proud of it.
It's great. That's a great lesson, dude. And it's amazing the way that script flips. And it's awesome to see the way you've kind of pivoted your outlook and your interventions. Okay, tell the millions of people listening, where do we get the pre-sale? I know how important that is.
becomeunbreakable.com/book bonus. And the /book bonus is very important because
Okay.
I know the pre-sale is a tough ask. I have pre-sold or pre-ordered a couple books in my entire life, and now I'm asking tens of thousands of people to go in and pre-sale. So we're like, how do we over-deliver to make sure we're saying thank you to everyone that does indeed go in and pre-order the Pain-Free Performance book? So if you pre-order one book, we're going to give you the first program, which is the Ultimate Pain-Free Performance Program, right away on an instant download. You can do that right over on the site. So you can train with us for 30 days on the Ultimate Pain-Free Performance Program just by pre-ordering one book. You know, if you're a business therapy owner, or you're a gym owner, or you're somebody who just wants to share this with other people, which we've heard a lot from, if you order 3 books, you get to have you and your staff go through the Ultimate Pain-Free Knees course. This is 10 hours of CEU approved education directly from Pain-Free Performance. And if you really want to up the ante, 25 books is the minimum, but you can go in and actually attend a 1-day virtual Pain-Free Performance course with the ordering of 25 books. And whoever orders the most books gets me teaching you at your facility or your clinic with my entire staff and a media team for an absolutely free, for your whole community and anyone who you want to invite, 2-day live Pain-Free Performance Specialist certification that happens in person. So we really just want to incentivize people to go in and drive action towards this. And if you're wondering, that sounds pretty good, but I just want to see what's inside, we have that as well. So if you go over to painfreetraining.com/book preview, you can download the first 2 chapters of Pain-Free Performance, give it a read for absolutely free. We're so confident that you're going to be blown away at the quality of Pain-Free Performance that we want to be able to have people experience it before it's even delivered to them.
Dude, I love it. That's awesome. We'll put those links in the show notes. So guys, get out there and get this thing, pre-order this thing. John's obviously a wealth of experience, humility, information. It's such a great resource. John, I'm so happy to have you back a second time. I can't wait to do it a third time after your second book, which will probably happen within the next year. So I really appreciate you being here. You were awesome. Thanks so much.
Thanks for having me again. I appreciate you.
Yeah, John, a pleasure. Guys, thank you so much for listening. Let us know what you loved. Let us know what you hated. Tell us what you hated, what John said, but I'm sure it's going to be a lot more positive. Find us True Sports PT on Instagram. Guys, thanks for listening. Bye-bye, bye-bye.